More and more health experts and government officials are weighing in on discussions about booster shots. Let's get some insights from NITAG member Dr. Conky Lim Quizon, who joins us now over the phone. Good afternoon, Doc Conky. Thanks for coming back on the show. What is your reaction to proposals on having booster shots included in the primary vaccine series? Do you think this is timely? What are health experts' opinion on this?
We cannot overemphasize the need for a booster shot. Actually, said in the context of the primary series, which is 2 shots, the international health experts are actually trying to see if the booster or the 3rd shot, as we're calling it, should be part of the primary series. So there should be 3 shots in the first place. So just so we don't confuse the public, we just call them booster shots at present. So the bottom line is we need booster shots. We need the additional dose on top of the 2 doses in the primary series.
All right, having said that, Dr. Conky, so it is your opinion that booster shots should be included as part of the primary series. How now do we encourage more people to get their boosters? Ideas that are currently floating around include house-to-house campaigns, that was from President Duterte himself, as well as restricting mobility and entry to establishments, meaning some sort of light penalties for not being boosted yet. Do you agree with all this?
Well, I agree with the first one, although that's really labor intensive, but if the local government units can afford to go house to house, then why not? Maybe what might work is bringing the vaccination opportunity closer to the people, like, for example, in malls or places that are frequented by the public. Then perhaps it would make sense to put vaccination centers there.
Right, Doc, but that would actually make it more accessible to people, but it would not convince them to actually go and get booster shots. What do you think is necessary to get people to go to these vaccination sites and get boosted against COVID-19? What can we tell them, or is there some sort of messaging that you have in mind?
It's really kulit, and more kulit. Just because we said it once or twice, that is not enough. We're trying to change behavior here. So knowledge, or them knowing that, well, booster shots are needed, fine. But in order to change, as I said, the behavior, it needs to be more concerted effort for the information. And in Tagalog, as we said, kulit, and kulit.
Right, so this kulit. But remember, when we were doing the initial rounds of vaccinations, Dr. Conky, they did put into effect, limited entrance to indoor venues and et cetera, as ways to encourage people to get booster shots. Do you think this kind of strategy would work again this time around?
Yeah, not necessarily, because the thing is, we are fortunate that it looks like we are at the tail end of the pandemic, but at the same time, it also lessened the scare tactic, or at least in people's mind, their need for boosters, because they're saying, oh, it's done now, we're over now with the pandemic. So, if we say we won't allow you in establishments, the very same people who have not been given booster shots, maybe they wouldn't really care if they're not going to those establishments, particularly, say, in restaurants.
Mm-hmm. All right, point taken, ma'am. Do you think, Doc, that the June 30 target or rough or soft deadline to inoculate at least half of the fully vaccinated population with boosters is actually achievable? It is already, April, and we're heading into the Holy Week.
I think that's achievable, especially if the local chief executives put their minds into it. Because remember that last year when we targeted 500,000 a day nationwide, people were so skeptic, and then we actually achieved 700,000, 800,000 a day. So I guess if we really put our minds on it, especially the local chief executives, then that is achievable.
That's right. So where there is a will, there is a way. Dr.
Exactly.
Conky, yeah. And what do you think, Dr. Conky, is the best way to utilize these vaccines that are nearing expiry? Would extending the shelf life of these vaccines that are on hand the best option?
At the moment, it looks like that's the best option. Because even if we want to, let's say, send it to other countries that may be more in need than us, then we're in the same boat. It's going to take some time. It's going to be expired already before it gets to them. So hopefully, because it's really what you call a grace period. You know, when it says it expires on such and such date, it's not as if, bang, at 12 p.m. on such date it's expired. No, it has a grace period. So that's one of the best options we have.
All right. Thank you, as usual, for your time and your insights and for joining us this afternoon. NITAG member Dr. Conky Lim Quizon over the phone. Thank you, ma'am.
Thank you, likewise.